channel. This is another one of my veterinary vlogs. However, this vlog is gonna be a lot different than the past vlogs that I've been doing. One, because I did not get enough footage this week to be able to make a full vlog. I've been super busy at work. We have been slammed crazy, and my partner has been out sick, so it's just been me. And two, a lot of you guys have reached out to me asking questions about, you want to be a veterinary nurse, or how do you do it, or how did I get into it, what's it like, and all these different kinds of questions, which are fabulous questions. I love hearing from you guys. You can always email me or write to me or whatever you want to do. All of my social media is linked down below, along with the rest of my veterinary vlogs and my PO box as well. So I'm going to try and address a lot of the questions that I have been getting. I'm sure I'm gonna forget something. Also, at the end of this video, or the beginning, I haven't decided yet, I am going to show the footage that I did get this week. It's not a lot, it's like maybe 2 videos, but it's still cool, so I wanna share it. Okay, so I'm gonna start by sharing a little bit about me and how I got into doing this, because I've been getting a lot of questions about that. I started working at a veterinary clinic when I got out of high school, actually. I went and worked at a clinic with my cousin because, I loved animals. I feel like everybody that wants to go into veterinary medicine always, we love animals, and that's why we want to go into this profession, to help animals and our little babies, which is part of the reason why I wanted to go into veterinary medicine. So I wasn't sure, I had never worked at a clinic. I knew nothing about a clinical setting. I knew nothing. I was straight out of high school and I didn't know anything. So my cousin was working at a vet, and she got me a job as a kennel assistant, and from there I just completely fell in love with working in a clinic setting and all the animals, which that is gonna be my first advice to you guys. If you're wanting to go into veterinary medicine, I highly, highly recommend that you get a job at a veterinary clinic. If they aren't hiring, ask if you can volunteer. Ask if you, can be their receptionist, if you can be their kennel worker. Some veterinarians won't hire you on as an assistant unless you have clinical experience. Some do. It just kind of depends on the veterinarian, honestly. I personally started at the kennel level, which looking back on it now was a great thing because I learned the basics, and then I got to watch and I got to observe, and I learned a lot of things from the veterinarian just by hearsay and what he would tell clients. It was a great foundation for me to start on, and if it wasn't for that first initial step, I wouldn't be where I am today. Just pick up the phone, call vets around you, bring your resume, ask if they're hiring, go volunteer. Because if you volunteer and you get hours and then you apply at a veterinary clinic and they see that you've worked in a clinic before, they're more likely to hire you. Anyway, so I started right out of high school. The vet that I am working at now is actually the 3rd veterinary clinic that I have worked at. So in total, I have been working in a clinic for 6 or 7 years. But when I was a kennel assistant, I got the experience that I needed, and so I steadily kind of made my way up the food chain, and I became a veterinary assistant, where you assist the doctors, you help, pull up vaccines, you basically do whatever the veterinarian tells you to do, which is a great thing to do. That is a great place to be. I have learned so much being a veterinary assistant. I wasn't satisfied with just being an assistant. I wanted a degree that I could hang on the wall with my license and my certificate. That is what I wanted, so that is what I'm getting. So currently, right now, I'm actually in veterinary nursing school. I'm getting my degree in veterinary technology, which is a 2-year program. I did go to a university and I got a lot of the prerequisites that I needed to get into the school that I am in now. So a lot of other questions that I have been getting is there a lot of math involved? Like, how much math and how much science is involved? I'm not very good at it. Can I still be a veterinary nurse? There is a lot of math, and a lot of science. So if you hate math and science, I feel like it's gonna be really difficult for you. So if you don't like math and you don't like science, you gotta like them. You gotta like them to get your nursing license. I love science, so that wasn't a problem for me. However, I'm average, mediocre at math, and I've really, really had to work very hard to understand its language, because math is its own language and it doesn't come very easy to me. Don't get discouraged if you're not good at math, because you can do it. Anything that you set your mind to, you can do it. On a daily basis, I do so many calculations, for drug doses, for fluid rates, for sedation, for anesthesia. Math is a really big part of my job because if you make the smallest mistake, it's a big deal in medicine. If you get your veterinary nursing license, veterinarians expect you to know what you're doing. This video is probably gonna be all over the place because I didn't have any of this planned. I just honestly turned on the camera and started talking to you guys. We all get into veterinary medicine because we love animals, and that is great. But doing this for so long, I have learned it's not just about the animals. You can't just love animals and think that you're gonna be great in veterinary medicine. I wish it was like that. I wish it was that easy, but I've learned that it's not. On the end of that dog's leash, there is an owner, and you also have to love people as much as you love animals. Another big part of my job is when your dog comes in sick, the veterinarian says, okay, this is what I think they have. I'm gonna get a treatment plan together and I'm gonna send my nurse in to go over it with you. At least at my clinic, that's how it is. So then I go into the room with you and your dog and I tell you, okay, Dr. X thinks that your dog has X disease or virus or illness or whatever's going on. I'm just like, she wants to start with blood work. You know, she wants him hospitalized, and you need to know what you're talking about because that owner is not going to trust you with their pet unless they feel comfortable leaving them with you. And that takes really good communication skills. Sometimes, at least the veterinarians I have worked with use lingo that is completely over a lot of people's heads. And if you've ever taken your dog to the vet, I'm sure you know what I'm talking about, because sometimes they talk to one another and they completely go over my head and I have no idea what they're talking about. So I break it down to a level that normal people like myself can understand, so that the owners know exactly what we're doing to their dog, why we're doing it to their dog, you know, how much it costs, medications that are going to be given, the medications that are going to be sent home. There's a whole bunch of stuff that involves people and talking to people and communicating with people effectively. You know, I went into veterinary medicine because yes, I did love animals, but I also fell in love with their owners as well. And I can't tell you how happy it makes me knowing that their owners are trusting me with their pet and that they know that I'm going to take great care of them, because I do. And that's a bond that you have to build with the pet and then also with their owners, which I don't think is a part that a lot of people think about. You know, I love animals. Yes, but all animals come with an owner and you gotta love them too. So I personally, every clinic is different, but I personally work from 6:45 in the morning until about 5:45, 6 o'clock at night with a 1 hour lunch sometimes. Because sometimes we have emergencies come in during lunch and you don't get a lunch. So they are very long and tiring hours and you're on your feet all day. You're gonna get pooped on and peed on, and you're gonna get blood on you, and you're gonna get snot on you, and you're gonna get a whole bunch of bodily fluids on you that are not cute and they're gross, but it can't bother you. So if you get grossed out easily, you gotta get past that. I literally in a day am running around doing multiple things at one time. You have got to be able to multitask to do this job, because I will pull blood from a patient, I'm gonna run that blood, and then while that blood's running, I'm gonna go and take radiographs, and then while my radiographs are done, then I'm gonna go prep that dog for surgery, and we're gonna get it on the surgery table so he can have his mass removed or his ovaries taken out or his testicles taken off. I am constantly doing multiple things. You know, in a day, I'm gonna go into a room, you know, with your kitten, and we're gonna do kitten vaccines, and it's gonna be fun, it's gonna be happy, and then right after that, the next room that I have is gonna be a euthanasia. It's definitely an emotional roller coaster, especially when you get attached to the animals and you also get attached to the clients, which I am really bad about. I love my clients and I love my patients so much, which makes my job really hard too. But that's also the reason why I love my job, so I don't regret getting really close to my clients / patients. When I tell people that I work at a veterinary clinic, the immediate thing that you think of is, oh, you get to play with animals all day. Yes, I do, but that's not all that it is. And I think when people come in that have never worked at a clinic before, they're kind of like, whoa, like I didn't know all of this was involved. So that's why I think it's such a good idea to go to a clinic. Now I'm gonna go get out of these nasty scrubs that I've had on all day. Alright guys, but thank you for watching this video. If you liked this video, don't forget to subscribe to my channel and I'll see you in my next one. Bye!